So the logical question is, what can we do to gain resilience so that we can neutralize the acute stress response when it's not adaptive? And we can reduce the chronic stress response, if you will, and lower our adrenaline, cortisol, and other hormones that are related to stress. And that will help us enjoy better sleep.
Cue music. Places, everybody, places. We're starting in 3, 2.
Welcome to the Autoimmune Hour, where we look at the rise of autoimmune disorders. I've brought together top experts that range from doctors, specialists, nutritionists, researchers, and even those recovering from autoimmune to bring you the latest, most up-to-date information about autoimmunity and how to live your life uninterrupted.
Thank you for joining us here on the Autoimmune Hour with Sharon Sayler. Always seek sound legal, medical, and or professional advice regarding any problems, conditions, and any of the recommendations you see, hear, or read here on the Autoimmune Hour, Understanding Autoimmune, and Life Interrupted Radio. Join the Autoimmune Hour's Courage Club. Sign up now at understandingautoimmune.com. Now, back to your host, Sharon Sayler.
Welcome, everyone, to the Autoimmune Hour. I'm Sharon Sayler from SharonSayler.com and, of course, from UnderstandingAutoimmune.com. And as always, it's my honor and pleasure to be with you here tonight on another brand new episode. And I am so excited. We have Dr. Greg Hammer on, and we're going to talk about sleep and sleep hygiene. And we'll explain what that is in a little bit. But he's got an amazing bio, and I want to read it to you. So sorry if I come in a little close to read the screen, but you guys know it's better than me trying to wing it, right? Dr. Greg Hammer is an MD and is a professor at Stanford University School of Medicine, a pediatric intensive care physician, pediatric anesthesiologist, mindfulness expert, and the author of Gain Without Pain, the Happiness Handbook for Healthcare Professionals. And he's a member of the Stanford Well MD Initiative, and Dr. Hammer is the former chair of the Physician Wellness Task for the California Society of Anesthesiologists. He has been a visiting professor and lecturer on wellness at institutions worldwide and teaches GAIN, G-A-I-N, to medical students, residents, and fellows at Stanford. I could go on and on. It's an impressive bio, Dr. Hammer. Thank you so much for being on the show.
Great pleasure. Thank you.
Now, thank you for being on the show about sleep and sleep hygiene. We don't talk about it enough. I think I've only had, in the 10 years we've been doing the show, one expert on the show, and that was a while ago. Because to me, sleep has been, at times when I'm having an autoimmune flare, one of the hardest things to do. Whether it's just my own mind running away with me, like, why am I having another autoimmune flare? Or maybe I'm in pain. But could you share with us the importance of sleep in regeneration and our overall health?
Yes, many people think that sleep is a passive process, and it really is not. There's a lot going on in our brain and certainly our body when we're asleep. In particular, during deep sleep, our brain is cleaning up itself, cleaning up a lot of junk proteins that tend to accumulate. Many people have heard about tau and amyloid proteins because they tend to accumulate in all of us as we age, but in particular are markers of dementia. So these proteins tend to cause so-called tangles of neurons in our brain. They're also prevalent in individuals with repeated head injury, notably football players, many of whom who have accumulation of these abnormal proteins do develop dementia relatively early in age. There's been a lot of that in the press, and Parkinson's disease is another manifestation of brain disease that's associated with accumulation of tau and amyloid proteins. So when we're asleep, our brain is clearing these proteins, and it's also getting rid of other material in the brain that really is pro-inflammatory. So when you talk about autoimmune diseases, of course, you're really talking about the body's inflammatory response, which was necessary, but when excessive can cause disease and even death. So sleep is associated with elimination of these proteins and even aging cellular and subcellular components that tend to promote inflammation. Of course, also there are memory processes going on when we're asleep that really depend on deep sleep. So we're consolidating memories of experiences and thoughts that we had during the day. So those are some of the brain functions that occur when we're asleep. And of course, there are a lot of other restorative bodily physiologic processes that are going on as well. So sleep is a very active process and very vital to our well-being.
Wow, that's so interesting because so when you're asleep, I'm not sure you realize all of that work is going on behind the scenes.
We're not aware, but almost by definition. Yes, you're right about that.
That's fascinating to me. Is there an ideal length of time to sleep, or is that kind of individually independent on how people sleep?
Of course, there are individual variations, but in general, I think the science supports that we need 7.5 or 8 hours of reasonably good quality sleep. And like everything else in life, and certainly in medicine, it's a bell-shaped curve. There are people on one end of the bell curve that maybe don't need that much sleep, maybe get by on 5 or 6 hours a night without deleterious effects. And on the other extreme, there are people that undoubtedly need more than 8 hours of sleep a night to function optimally. But in general, we can talk about the middle of the curve, the 95% of us that really do need 7.5 or 8 hours of sleep every night. I think it's really crucial to focus on those conditions that promote sleep and those that oppose good sleep.
Well, I keep thinking about interrupted sleep. Like sometimes maybe I'm in bed for 8 hours, but it's not uninterrupted. I'll either wake up and be able to go right back to sleep, or maybe I have to use the restroom or other things. Is that harmful where you're not sleeping for the full 7.5 or 8 hours?
It would be ideal if we slept uninterrupted for 8 hours and woke up in the same position we were in when we fell asleep. But that is pretty uncommon. It's quite common, and I guess you could say normal, to wake up once or twice during the night, maybe get up and you have to pee. So a couple of awakenings at night are certainly common, and I think they would be considered normal. I often wake up more often than that. I'm very sympathetic to people that wake up relatively frequently, and usually I can go right back to sleep, but not always. And I think this is really a problem that almost all of us have. There are people that just sleep through the night on a routine basis, but for most of us, we do end up awakening at least once or twice during the night and sometimes more frequently. And as to whether it's harmful, I think it's really hard to say. It's just a fact of life that we wake up during the night. And I think that we wake up typically when we're in lighter sleep. So hopefully that means we've had a cycle or two or three of deeper sleep, REM sleep, and those phases of sleep that we know are restorative.
I know a common complaint of people with autoimmune is what they call brain fog. And oftentimes, at least for me personally, I've related it to either disrupted sleep or a lack of sleep, that my brain is much more foggy in the morning, that I have not felt I slept well.
Absolutely. Yes. There are a lot of causes of what people call brain fog, especially now that COVID is so prevalent. A lot of people have residual effects of COVID, whether it qualifies as long haul COVID or long COVID or not. A lot of people have brain fog for some period of time after COVID and other viral infections. And there are certainly a lot of causes: metabolic, immune, other causes. Aging itself, cardiovascular disease can produce changes in the brain that may lead to what we call brain fog, and certainly lack of good quality sleep. And we really need to consider the quality as well as the duration of sleep. So when one or both of those are deficient, brain fog is a common side effect.
I'm putting that down, that we're having you back on to discuss brain fog, because this sounds like I went down a rabbit hole that's more deep than and more wide than we have the time. So we're going to bookmark it there. That has me fascinated. Okay, so now a couple of other questions about sleep. And what about dreams versus nightmares versus vivid dreams? Are any of those like an indication that something's wrong, or are all those quite natural?
I think those are all common and I would say natural. I'm not a psychiatrist. I'm not really an expert on that domain, I think, that you're entering into with regard to how we interpret nightmares, sleep terrors, such things. But I think they're certainly very common. We do tend to dream during certain cycles of sleep, during REM sleep. And of course, dreams are quite normal. And what exactly is happening to explain the dreams that we have, why we remember them or don't remember them. I think typically if we wake up proximate to the time of that phase of sleep when we're dreaming, we may remember it temporarily. A lot of people will write them down so that they don't forget. But as to the sort of psychologic significance of the content of our dreams, I'll have to defer to somebody with more expertise in that area.
I remember a couple of times in certain medications I was on. Now, this is the Science of Sharon community. I want to say that while I was on them, my dreams were much more vivid and more memorable. Is that uncommon to have maybe something you ate or took during the day affect the quality of sleep and even the quality or the intensity of things like dreaming?
There are drugs that actually seem to be associated with vivid dreaming. Certain antidepressant, anti-anxiety dreams may be associated with vivid dreaming. And otherwise, I think we all have particularly vivid dreams, at least occasionally. And as far as our diet and other aspects of our lifestyle, I don't think anybody really knows what the factors are that lead to that kind of dreaming, other than certain medications seem to be predisposing.
I want to circle back, though. You've got me totally fascinated about the harmful proteins and the aging mitochondria. Is there a way with these proteins are collecting in there? Is there a way that we can help either by diet, exercise, or other lifestyle choices and good sleep that can help the brain remove these harmful proteins?
I think maybe if we just take the 30,000-foot view of dementia, what are the factors that predispose to dementia? And those accumulation of those proteins, among other things, is associated with dementia. Whether they're actually causative or just an association, I don't know. I'm not sure that's known, but really, in the entirety of our lifestyle has to do with how we age, and the diseases of aging are largely considered four. There's cardiovascular disease, there's neurodegenerative disease, which includes dementia, things like Parkinson's, et cetera, Alzheimer's. There is associated with aging, cancer is certainly one. And then there's metabolic disease, so-called metabolic syndrome, which is really obesity and type 2 diabetes. So cardiovascular disease, neurologic or neurodegenerative diseases, metabolic syndrome, and cancer are diseases of aging. And in fact, aging itself may be considered a disease. And when we look at the neurodegenerative diseases, they may be associated with accumulation of these proteins, tau and amyloid proteins, but also a number of other factors. And they're very interrelated, these four classes of disease. So cardiovascular disease may result in decreased microcirculation to the brain. That is, what's happening in the small blood vessels in the brain and elsewhere in the body, but specifically related to the brain. And the state of those small blood vessels will have significant impact on oxygen delivery to brain cells or neurons. And so when we have cardiovascular disease, we're predisposed to neurovascular or neurodegenerative diseases like Alzheimer's and other forms of dementia, Parkinson's disease, and so on. So these four diseases of aging, these four categories are really very closely interrelated. And so when you talk about brain fog and dementia, how can I reduce my chances of having brain fog, decrease the frequency of being in that condition, and how do I decrease the risk of dementia and other neurodegenerative diseases? The answer is really having a comprehensive lifestyle approach to wellness. And we can actually impact the aging process itself by the way we live. And I would simplify the important factors related to our lifestyle as in the categories of sleep, exercise, and nutrition. And then perhaps under the nutrition umbrella would be supplements. And then there are actually drugs that may slow down the aging process. But I think the main issues that most of us really need to think about and address in our daily life are sleep, exercise, and nutrition.
Okay, obvious question, and I think it's generalized, not for autoimmune specific, but is it ever too late to start?
No, it's not. In fact, there are always going to be benefits of really focusing on good sleep hygiene, trying to optimize our sleep, our exercise, and that could be a whole separate discussion, what kinds of exercise are best, et cetera, and the way we eat. And that's also a long discussion in terms of what is the optimum diet. But I think having good sleep hygiene, planning on 8 hours a night, exercise on a regular basis, both resistance training and aerobic or cardio training, as we say, as well as balance and core strengthening. And then in the domain of diet, look at where are the most centenarians living in these so-called blue zones around the world and what is their diet like. And generally the Mediterranean diet, largely plant-based, some seafood, the right kinds of fats, not a lot of sugary foods and not a lot of refined foods. So those are all things that we can do to slow the aging process in general. And that will have, and they're very interrelated as well, because there's a bidirectional relationship between sleep, exercise, and nutrition, right? They're very closely interwoven. So when we don't sleep well and we're fatigued, I can tell you as far as what I eat when I'm tired, when I've been up in the ICU most of the night, and the next day I'm walking past a nursing station and a grateful family has been kind enough to donate a large box of chocolate candies, which is sitting at the nursing station. There's nothing that hits the spot like one of those chocolates. And that sugar rush that you get, especially when you're tired, feels great. And many of us crave sugary foods when we're really sleep deprived. Of course, they may give us a temporary boost in energy and then we crash. I try not to indulge too much. The relationship between sleep and way we eat, another function of sleep that affects how, what, and when we eat is that the hormones, many hormones are actually regulated during sleep and rebalanced. And the hormones that regulate our appetite and how full we are from eating, satiety is the technical term for that. Those hunger and satiety hormones are rebalanced when we're asleep. When we don't get enough sleep, the hunger hormones tend to take, and so we tend to want to eat more when we're tired, and particularly sugary and fatty so-called comfort food. So again, sleep, exercise, and nutrition very tightly interwoven, and good exercise promotes good sleep, healthy eating promotes good sleep, and vice versa.
Which I think we all know, but as you said there, we all have these moments of weakness where some comfort food from our past really sounds good.
Knowing and doing are two different things. So I think I try to break things down for myself, and when I'm teaching and having conversations with people like you, into sort of simple, not to coin a pun, but bite-sized components, if you will. And that's why really our health really relies simply on sleep, exercise, and nutrition as being integral. And we know what to do, as you said, but it's also important that we hear the truth repeatedly to reinforce what we already know. I know when I go to a medical or scientific meeting, a lot of times I'm hearing what I already know, but it's reassuring to hear it from some other expert. And it really does tend to consolidate or fortify my knowledge in that area. So yes, we know what to do, but we need to be reminded, and then we need to be induced, mainly through ourselves, to do those things that promote good health.
And I always like to say, it sounds so simple, but it's not always easy. I want to circle back on something you said about sleep position. We didn't really discuss that, but I am curious, is there a particular position that you recommend, our side sleeper, left, front, back, or is that just a personal preference?
It's a personal preference. I think certainly many of us, especially as we age, develop some degree of what we call sleep state airway obstruction, commonly manifest as snoring. And certainly when we sleep on our back, our tongue tends to fall by gravity to obstruct our airway by falling against the back of our throat, for example. So sleeping on our back is not great if we tend to snore. Sleeping on the front of our body, in other words, being prone, face down, may not be good for our back if we have low back issues, for example. So there are specific things that are perhaps healthiest for certain individuals, depending on whether they tend to have sleep airway obstruction or orthopedic issues. Certainly sleeping on your side if you have shoulder problems. It's the position, it's the mattress, etc. But I think we all tend to find a position of comfort.
No, I definitely have a preferred position. And I notice I have to be in that position at least to fall asleep. I don't always wake up in that position though. And one of the comments you said was to be in that position. It sounded like, okay, for 7, 8 hours. I tend to move a lot more than that.
Yeah, most of us do.
As we're talking, you mentioned pillows. There are so many options of pillows. Do you have a preference that you suggest for people? I think before I found my favorite pillow, I probably bought like 10 pillows. It was crazy. I've got a stack of pillows that my grandkids love to jump in because I just like, yeah, they're nice pillows, but they just don't work for me.
I think that's very common. I think it's trial and error for sure. It's just like the mattress. Some people do better with a very firm mattress. Some people do better with a softer mattress. I think if you tend to sleep on your back, a firm mattress is good. If you tend to sleep on your side, you might want a little bit more yield in the mattress to promote having a relatively straight spine. That depends on your body habitus, etc. So I think it's the same with pillows. We all have our own preferences. I like a bulky, medium firmness pillow myself that I can bunch up. Many people, including myself, to sleep with a pillow between their knees. It promotes good lower spine positioning. So it's really highly personal. And as you suggested from your own experience, unfortunately, most of us go through a bit of trial and error before we settle on the pillows that we like best. And we end up with a closet full of pillows that we don't use.
Yes. I won't bring up the argument over dual sleeping and mattresses because that could open a whole can of worms. You mentioned about how people like different mattresses, and the problem with it is when you have dual sleeping or a sleeping partner.
There are mattresses designed for that. I won't use a brand name. There are mattresses. I don't know. I don't particularly think the quality is necessarily the best, but there's an air mattress nestled in between layers of other material, and you can inflate or deflate the air mattress component according to the firmness you desire. And each partner may be able to do that on their own independently. But yeah, there are an awful lot of options out there for beds.
As we're talking about mattresses that do magical things, what about the ones that you can lift your knees, you can lift your feet, you can lift your head? Is that just personal preference too, or is there harm to sleeping maybe in a more, I will say, somewhat seated position or a position where your feet are higher than your head?
I have one of those beds myself. It has the ability to have the head and area under the knees more or less elevated electronically. I think if you sleep on your back, that's great. If you can sleep with your head elevated, again, if you change positions a lot and you're going to want to sleep on your side, having just the head of the bed elevated at an angle of 30 degrees or so probably won't work for you. But if you do tend to stay on your back, especially if you have some sleep airway obstruction, having the head of the bed elevated is great. Similarly, for your spine, particularly lumbar spine, having something under your knees, whether that's the bed doing that or a pillow under your knees, is helpful from an ergonomic standpoint. Again, highly individualized. For me, I use the mechanism to elevate the head of the bed and elevate the portion under my knees, mainly if I'm intending to sit up and read, for example, or perhaps watch television. But for sleeping, because I do tend to sleep on my side and I change positions a lot, I need to have the bed flat. I imagine that many people would share that preference.
Mhm. I've heard from other experts about when you mentioned television and things like that, and I have to be honest, I'm a TV in the bedroom kind of person myself. But about all these different forms of ambient light that are now there, like whether you have a air purifier in the room that has a light, or your TV emits a little light, or oh my goodness, your phone. What are your thoughts on all these ambient lights?
People talk about not only ambient light, but electromagnetic radiation in general. So that would include electronic devices that are plugged in, whether or not they're actually turned on, they may emit this electromagnetic radiation, or EMR. And as a scientist or somebody who's scientifically inclined, I'm not that impressed with the data that EMR is particularly unhealthy for most of us, but there are certainly those who would disagree. As far as light as a form of electromagnetic radiation, so it would be under the umbrella of EMR. And beyond that, we could say that the wavelength of light may affect our circadian rhythm. I think that if it's a tiny little light in a relatively distant part of the bedroom, I doubt whether it has much effect, unless we're very light sleepers, in which case I would certainly recommend an eye mask, since they're inexpensive and generally pretty comfortable and help create a dark environment. But blue light in particular, the short wavelength light that's in the blue part of the spectrum, does tend to activate us. So it does affect our circadian rhythm. That's why many people recommend that we get up in the morning, we immediately open the blinds, that we go outside without sunglasses as early as we can to get natural sunlight. One of the benefits of that is that blue light, as part of the spectrum of sunlight, is activating. So it tends to arouse us, wake us up, and we don't want to have that at night. And that's why one of the reasons that it's recommended really to put your screens away as part of good sleep hygiene at least an hour before you want to go to sleep. So that means your phones, your tablets, your laptop, and even television. There are, of course, blue light blocking glasses. So glasses that you can wear that have a pretty clear lens, but they tend to block out blue light selectively. I think for the most part, those are not necessarily perfectly effective. So I think that it's recommended still, and I recommend putting your screens away an hour before you go to sleep. Again, these elements of sleep hygiene are individualized. For example, for me, caffeine, I'm very sensitive to caffeine. Caffeine has a very long half-life. If I had a cup of coffee at 1 o'clock in the afternoon, which I used to have after lunch, we get that little sag in energy level as the blood flow is diverted away from our brain to our gut for digestion. Some coffee really hits the spot, but caffeine has a half-life of about 5 or 6 hours. That means that the concentration that you have in your bloodstream and your body a half hour or 45 minutes after that 1 o'clock cup of coffee, that blood concentration, half of that is still there at 6 or 7 o'clock in the evening, and a quarter of it is still there at maybe 11 or 12 o'clock at night. And so for me, since I'm sensitive to caffeine, that definitely disrupts my sleep. So I stopped having the cup of coffee after lunch, and I found that my sleep was improved. Now, there are people that can have a double espresso right before they go to sleep and they're fine. So we're really talking about the middle of that bell-shaped curve. And for most of us who are at least moderately sensitive to caffeine, they should avoid it. Caffeine, alcohol, heavy meal, all to be avoided proximate to bedtime.
Mm. I'm up in favor of the heavy meal, but I must be on the far end of the bell curve. I don't notice caffeine. I could have an espresso after dinner and be fine. So I guess I'm on the far end of the bell curve.
Yeah, people drinking coffee at night, and I'm assuming it doesn't interfere with their sleep. Otherwise, they wouldn't be drinking it then. But there are people like you who are not very sensitive to caffeine.
Yeah,
as opposed
sensitive to
people
a
like
lot
me.
of other things, but not caffeine, which is amazing how we're all so different. You had mentioned circadian rhythm. I want also to talk about sunlight in the morning, but you had mentioned circadian rhythms. Is there a specific time we should go to bed, or how does one determine what their circadian rhythm is to know how to maximize your sleep?
That's a good question. People talk about being night owls versus being a morning person. So I think it is individual. For most people who work, they have to get up at a certain time in order to get ready to go to work. That determines when they have to get up in the morning, which should then advise when they should go to sleep at night. But
So they just count backwards.
exactly. So
Okay.
yeah, it's a skill, but get out your calculator if you need to. But yes, count backwards to 8 in hours from when you have to get up, and that's what time you should go to sleep. But if you don't have to get up at a particular time to go to work, then I think you should just listen to your body and what works well for you. Obviously, for many of us, if any light is getting into the room in the morning, it tends to be arousing. I have blackout shades that do a pretty good job, and then an eye mask as well, because I tend to be a light sleeper and light does wake me up, even when my eyes are closed, of course. So, no, I think you have to see what makes sense for your own lifestyle and your schedule and just try to establish a pattern. It is considered in the good sleep hygiene column to go to bed around the same time and wake up around the same time every day. So even if you have to get up at 7 o'clock in the morning to go to work during the week and you don't have to do anything that early in the morning on the weekend, it's still advisable to get up at the same time on the weekend.
So you can't make up sleep.
I guess there's 2 points. One is that it tends to promote good sleep when we go to bed around the same time and wake up around the same time every day, including on the weekend. Separately, making up for a sleep deficit, to some extent, if you're sleep deprived, if you've had less than 7.5 or so hours of sleep for one or more nights in a row, or maybe have been up all night, you do make up for the deficit to some extent by getting extra sleep in the subsequent nights. But I think it's a relatively minimal catching up of sleep, if you will. So I wouldn't recommend relying on that and routinely getting maybe 6 hours of sleep during the week because you like to stay up late and you have to get up early, and then assuming you're going to make up for it on the weekend, even if you do sleep in on the weekend, it's not really good sleep hygiene, and it doesn't really make up for your sleep deficit completely. You're probably still going to end up being tired, sleepy, maybe have brain fog, etc., even on the weekend when you've slept for maybe 10 hours. I think the science really supports getting around 8 hours of sleep every night and going to bed around the same time, waking up around the same time on a daily basis.
And I can hear many in our community, because I've been there. Luckily, I'm not there right now, but I have been there saying, oh, to have 5 or 6 hours of sleep would be great, let alone 7 or 8. Oftentimes with autoimmune and the inflammation, our bodies are just so sore that trying to get comfortable sitting, standing, or prone is really difficult. Do you have tips for people that deal with what I'll say either mild to moderate? We could even go into extreme pain, but let's just talk about mild or moderate discomfort.
That's a tough one, of course.
I know it's so individualized.
Truly. And I think not to minimize anybody's pain by any stretch, so I don't mean to do that, but pain is a subjective sensation by definition. So I think a comprehensive approach to dealing with pain is very worth investigating and practicing. Not that even under the best of well-trained minds, circumstances, pain is going to disappear when you have a chronic painful condition. But as far as sleep, aside from acetaminophen or the usual range of nonsteroidal anti-inflammatory drugs at bedtime, there are selective COX-2 inhibitors like Celebrex that, and pardon me for the brand name, but celecoxib, I guess I should say, for people that don't tolerate nonsteroidal anti-inflammatory drugs in general, meaning they get an upset stomach or gastritis, and that might interfere with their sleep if you take ibuprofen or another such NSAID at bedtime. But celecoxib is one that you can take that is less likely to bother your stomach. So those things. And then I think it's very interesting to look at the data regarding cannabinoids, CBD, non-THC containing cannabinoids that interact with pain receptors and provide some degree of pain relief and also are anti-inflammatory. So many people take CBD before they go to sleep at night. And I think for many people, that is very helpful and may help treat pain and inflammation overnight.
Definitely one to speak to your doctor about, bring those ideas to them and let them help you sort out your individual issues with getting quality sleep. And part of what we have to do right now is take a quick commercial break, and we'll be back in 2 minutes to find out more about sleep hygiene and ways to improve our brain health, because I'm finding out that these two are very closely related. So we'll be right back.
The Autoimmune Hour will return after these messages from our sponsors. It's great sponsors like these that keep this show coming to you every week. Be sure and stop by understandingautoimmune.com to learn more.
Om Times TV. Imagine becoming a super influencer. Reinvent yourself, invest in your brand, and then manifest your success with a robust spheric approach. Om Times Media and Broadcasting offers a unique and multifaceted way to become the spiritual and conscious influencer you deserve to be by putting your message across our powerful platform with its proven record of integrity and excellence. Through our produced shows, Om Times offers the opportunity to become a social media TV personality, a radio show host, an Om Times magazine columnist, and a syndicated podcaster, all in one shot. By live streaming your show on Om Times TV and broadcasting it across the extensive Om Times radio and TV networks, you become more than a host. You become an ambassador and a force for positive change. Om Times. Open yourself to the possibilities.
If I could be you, and you could be me for just 1 hour. If we could find a way to get inside each other's minds. Walk a mile in my shoes. Walk a mile in my shoes. Well, before you abuse, criticize, and accuse. Walk a mile in my shoes.
Welcome back, everyone, to the Autoimmune Hour. I'm Sharon Sayler from Understanding Autoimmune, and you can find all of this episode and all of the almost 500 episodes over at understandingautoimmune.com or on YouTube. And by the way, if you're watching this on YouTube, please subscribe because it really helps us build our community and get the message out to a larger group that you are not alone and that we are here to help support you in understanding that you can live a full and complete life, becoming a survivor to thriver and have a great life even with a diagnosis. So one of the things that we're talking about has something that I've struggled with off and on through the 10 years of my diagnosis is sleep. And that's why I asked Dr. Greg Hammer to come on the show and talk about sleep hygiene. And he, as I said at the beginning, he's a professor at Stanford University of Medicine, a pediatric intensive care physician, pediatric anesthesiologist. That's so hard to say, and mindfulness expert. And there's a couple of things I want to talk about mindfulness and sleep, if you would. Share some of your thoughts on how we can use specific mindfulness practices to prepare us to sleep or get us into that mood to sleep.
Sure. That gets to the greater issue of stress in our lives. And when we talk about stress, we can talk about acute stress and chronic stress. Acute stress, as you would imagine from the term, involves a rather sudden response to something stressful. It involves a number of physiologic responses, such as release of epinephrine, also called adrenaline in our body, among other things. And it's a response, the acute stress response, that evolved over probably hundreds of thousands of years because it contributes to preparing us to fight or flee, the so-called fight or flight response. And it also tends to cause a focus in our concentration. This was adaptive when we were sitting in a cave trying to keep the fire going, and there could be a saber-toothed tiger lurking outside the mouth of our cave, and in fact, maybe poked its head in our cave. We want to be able to respond quickly, activate our muscles, get sugar to our muscles, and all those things in order to fight or flee. The problem is that we still have this acute stress response, but we're rarely, most of us, fortunately, faced with an actual threat. So it turns out the acute stress response is mostly triggered by our thoughts. So it is generally or often not adaptive. We think of something stressful, anxiety-provoking, and we get a surge of adrenaline and so on. And that is not necessarily adaptive, but it's okay as long as we have the resilience, the tools to neutralize those acute stress responses. Otherwise, we're stuck with an elevated level of adrenaline on a chronic basis. And back to the diseases of aging, that promotes cardiovascular disease, and even the other diseases of aging are promoted when we have chronic stress. Cortisol is another component of acute and chronic stress. So when we don't neutralize the acute stress response, our cortisol tends to remain elevated. That has a lot to do with our immune system. And actually, cortisol and cortisol-like drugs are therapeutic for autoimmune diseases, but when they're given chronically, they have a number of adverse effects, including suppressing our immunity and maybe making cancer more likely. So again, long-winded way of saying that the acute stress response is often maladaptive, but as long as we can neutralize it quickly, that's okay. When we can't, we're stuck with this chronic stress, and that certainly interferes with our sleep. So the logical question is, what can we do to gain resilience so that we can neutralize the acute stress response when it's not adaptive, and we can reduce the chronic stress response, if you will, and lower our adrenaline, cortisol, and other hormones that are related to stress. And that will help us enjoy better sleep.
I know in the acute stress phase, what happens to me is not only what's happening, the saber tooth at that moment, my brain's remembering every other saber tooth that ever happened. It almost becomes chronic because it's like this, okay, rolling ball downhill.
No, you're right. It does. Its stress response is often not neutralized when it's acute and does become chronic for most of us, and to varying degrees, of course. But stress certainly interferes with sleep. And then again, this bidirectional relationship, when we're not sleeping well, we're predisposed to stress. So you get this sort of self-propagating positive feedback loop. So how can you help ameliorate that? And one way is to have a mindfulness meditation practice. And that's what my GAIN practice is all about. It's based on a way of breathing, because when we're stressed, we have tight muscles in our chest and diaphragm, and we can go for a whole day without really taking a deep breath and breathing properly. So the breath is key to essentially all forms of meditation and stress relief as well. And so the GAIN method employs healthy breathing and a self-guided tour of that for which we're grateful, the G in GAIN, acceptance of things that are unpleasant that cause us stress, that's the A in GAIN, our intention, the I in GAIN, and non-judgment, the N in GAIN. And so this is a practice that can be done in 3 minutes. We go to slow, deep, deliberate breathing, and then we do a self-guided tour of that for which we're grateful, things we need to accept, what is our intention, including this practice, and then learning to drop judgments, which tend to be rather negative, of others, the world, and ourselves, and then returning to pure focus on the breath. This is a great way to relieve stress. Having a GAIN practice or other mindfulness meditation practice proximate to the time of sleep is wonderful. Even just a gratitude practice, thinking of 3 things that went well during the day and things for which we're grateful. Thinking of 3 good things, writing them down. If you're a journaler, that has been shown actually to promote healthy sleep. The more we can really embrace this mindfulness practice, the better off we are, the more we can reduce stress, the more we can favorably impact the diseases of aging and aging itself, and importantly, improve our sleep.
And I love those GAIN, GAIN, all of those gratitude. Let's go over them again. So gratitude, I want to say
Acceptance.
acceptance. I was going to say attitude.
That too.
Intention and
Intention and non-judgment.
non-judgment. Okay, those are great. And what's interesting in the work I do in my corporate life, where one of the things I talk about all the time is the power of breathing. And whether we're trying to sleep or whether we're trying to give a presentation, mindfully being aware of how we're breathing throughout the day and into our rest time is critically important. And I don't think people realize how fast our bodies will shift. For me, 2 or 3 great deep breaths, intended breaths, mindful breaths, I'm amazed at how fast my body begins to recover in just when I reset it.
Absolutely. No, I think just any one of those components of the GAIN practice, certainly the breath, just taking a slow, deep, deliberate breath, and then maybe repeating, as you said, that by itself is great for relieving stress. So slow, deep inhalation to a count of 3 through the nose, pausing to a count of 3, and then just gently but deliberately letting the breath go to a count of 4 through the nose or mouth. and repeating that, inflating the chest and breathing into the belly, into a count of 3, pausing to a count of 3, exhaling to a count of 4. That by itself will activate our parasympathetic nervous system, the side of the nervous system that helps balance the sympathetic or fight or flight side of our sympathetic nervous system. So deep, deliberate breathing activates the vagus nerve and parasympathetic nervous system, tends to slow our heart rate, reduce our blood pressure, lower our adrenaline and cortisol levels, and thereby is a great stress reliever in and of itself.
Oh, absolutely. One of the things that I like to do is make sure that I think people think that they're deep breathing, but their rib cage is still not moving, or their belly, I don't want my belly to protrude. I don't want to be fat when I'm breathing. But I like to think about when my children were newborns and you'd see how they breathe. The whole torso is involved. It's not just like from your mid-chest up. And unfortunately, I think in so much of our modern society, people think they're deep breathing, even though really they're only breathing with half of the structure.
That's a good point. I think many people recommend visualizing having the air go into the belly, breathing into the belly, but of course your chest is expanding at the same time. So yeah, with a real deep breath, if you just focus on fully expanding your lungs and imagine breathing into your belly, you're getting a very good breath.
I have a few women clients who are like, I don't want my belly to look big. And I'm like, if you're in a meeting or whatever, nobody's paying attention to what your belly's doing. I'd much rather have clarity of mind from having enough oxygen in the brain than I would worry about what the little half-inch out my hips protrude from breathing correctly. Wow, my goodness, this has been fascinating. We're going to have you back because there's so many questions I didn't get to ask. But we're down to the last couple of minutes. Dr. Hammer, please share with us any final tips you'd like to share or something that I didn't ask.
Often when asked that at the end of the hour, I will say that we all have a negativity bias. We tend to remember the negative and forget the positive and ruminate over negative things. And so for all of us who are so afflicted, which is really all of us to some degree, you're not alone. This is not your dirty little secret. It's okay to have negative thoughts. It's a matter of how we respond to them. And so, again, I think a mindfulness meditation practice is so vital, not only for our sleep, but just how we respond, retraining our brains to respond to stressful and what might be negative and anxiety-provoking stimuli during the day. And so we all have work to do. We can all do better. We're all in this together. But remember that there are simple practices that will not only promote sleep, but also reduce stress and healthier living.
Thank you so much. Now, I know the title of your book is Gain Without Pain, the Happiness Handbook for Healthcare Professionals. But if we're not a healthcare professional, can we also read it?
Yes, you have my permission to read it.
Okay.
No, I think it's the principle. It's really all about the GAIN method and reducing stress and burnout. And so it's really a book for everyone. It's just that my publisher at that time wanted me to include a subtitle and target a particular segment. But the book came out 3.5 years ago, and most of the TV, radio, and podcast interviews I do related to the book have nothing to do with healthcare professionals.
Well, other than your presence here with us today. So where can we find the book?
The book is on Amazon and elsewhere. My website is greghammermd.com, GREGHAMMERMD.com. There's a lot of media there, a lot of other useful information, and a link to the book as well.
Thank you so much, Dr. Hammer, for sharing all your insights today. I think sleep is one of those things that's often overlooked in how we got where we are and how it can help us get back to where we want to be.
Thank you very much. My pleasure.
Thank you, everyone. Have a great week, whatever your adventures. Enjoy.